Hello, I'd like to share some information with you today in regards to reality versus perception, more specifically connecting that to mental illness in the form of delusional disorder. So delusional disorder, previously called paranoid disorder, is a type of mental illness called a psychosis in which an individual cannot tell what is real from what is perception and or not based in reality. The main feature of this disorder is the presence of the delusions, which is a belief or beliefs in things that may not be rooted in truth or reality. So individuals with delusional disorder experience non-bizarre delusions involving situations that can occur in real life, things that they perceive being conspired against, for examples. So the delusions usually involve misinterpretation of perception or experiences. In reality, though, the situations are either not based in reality and or exaggerated. So individuals with delusional disorder often can continue to socialize, function quite normally, apart from the delusional part. It's unlikely that an individual with a psychotic disorder, with other psychotic disorders, who may also have delusions as part of their symptoms of their disorder. In some cases, though, individuals with delusional disorder may become preoccupied with their delusions that have their lives a bit disruptive. Also, I want to include that this information is coming from clevelandclinic.org. If you're looking to have more specifics involving this particular topic. So there are different types of delusions. Those are grandiose, jealous, persecutory, erotomatic, somatic, and mixed. So what are the causes of delusional disorder? So there are many factors, right? The exact cause is not yet known. Researchers do know that there are some variables such as genetic, biological, environmental, and psychological factors that play a part. So what are symptoms of delusional disorder? Some can be feelings of irritability, low mood, angry, hallucinations, either hearing or seeing things that may not necessarily be there that are related to the delusion. So how is the delusional disorder diagnosed? A mental health provider, psychiatrist, psychologist, therapist, counselor that are licensed or trained in the specific area of diagnosing mental health disorders would have an assessment completed, an evaluation completed. They can use those words are interchangeable. So how is delusional disorder treated? It's a combination of medications as well as psychotherapy. So when I say psychotherapy treatments, we're talking about individual therapy where an individual works with a mental health provider and assisting them, supporting them with identifying as well as implementing coping skills that are underlying in the distorted way of thinking. There's also cognitive behavioral therapy, CBT. That's when an individual learns or identifies what is reality-based and what is not, and changing the thought patterns and behaviors that led to those troublesome feelings and or thoughts. There's also family therapy for the family members that have a loved one that is diagnosed with delusional disorder, so that they can gain tools to better assist and support the person that is diagnosed with delusional disorder. And then there's medications. So with the medications that would be prescribed from a nurse practitioner, a psychiatrist, a medical doctor, things of that nature. There are many medications that can assist, and though I want to stress that it is important that with medications that the mental health piece, the psychotherapy is also assisting the individual. So it's like a combination of the two. How is or can delusional disorder be prevented? There's no real way of preventing this delusional disorder, and the early diagnosis and treatment can assist in decreasing the disruption in the person's life. So I want to just focus upon very quickly. I know I've used the word often, but seeking the support of a mental health provider as well as a psychiatrist and or a medical person that is able to prescribe the medication. I hope this information was of assistance for you today, and I hope you enjoy the remainder of your day.